Good afternoon. A member of my staff informed me that 2 months ago, the United States had just 15 confirmed cases of the novel coronavirus. 51 days later, we have over 605,000 confirmed cases throughout our country and a staggering number of recorded deaths. As many of you know, Linn County has been considered a hotspot for the virus, and recently Governor Reynolds has deemed our region a level 10. What this means to me is that we have more work to do. Our goal now is to become a hotspot of recovery, and hopefully through our efforts, we can demonstrate to the rest of the state how to best handle these tough times should the number of confirmed cases continue to rise in other areas, in other counties. I want to start today, however, by talking about an issue that's been on my head and my heart for quite some time. I've mentioned this issue in earlier briefings, but now it has come to a head, and we may be facing a crisis within a crisis. With the tragic news from this morning that 2 workers in a Tyson's plant have died, the essential question must now be asked and answered. What are we doing to keep our workers safe during this global pandemic? We refer to many of these workers as essential, which I wholeheartedly agree that they are, but we must be careful not to treat them as if they are expendable. Many of these individuals working in these plants and large manufacturing facilities across the state are immigrants, refugees, or belong to racial or ethnic minority groups. This fact alone does not make their lives more valuable than any others, but it underscores a reality we are seeing across the nation. Minority groups are disproportionately impacted by the coronavirus for a host of reasons, and oftentimes, due to their economic situations, are not able to access the same protections of many others. Being able to socially isolate for long periods of time by working from home is a luxury. Being able to buy groceries to keep the house stocked for a month is a luxury. I bring this up because I want everyone in this state to be aware of what is going on, because if left unchecked, this issue can certainly impact all of our lives. It has already been reported that several food processing and meatpacking plants across the state have shut down due to coronavirus outbreaks at their facilities. If these plants stay down long enough, we could very well see interruptions to our food supply chain. And it won't just be our grocery stores that are impacted. We all know that Iowa is a breadbasket to the entire world. These individuals working in these plants, they pay taxes, they have families, they have hopes and dreams just like the rest of us. And surely we can all agree that they deserve the same respect and protections as grocery store workers at the end of the food supply chain. A friend who works at a nonprofit that serves the refugee community received this message from a client yesterday. The client is a single mother who is working at a factory, and she came to Iowa as a refugee after surviving war in Burma. And it reads, "I have lupus, and I was afraid I would die if I kept going to work. We work so closely together, and people were getting sick. So yesterday I quit my job. I am so scared. I don't have health insurance now, and I'm not sure how I can feed my children or pay rent. I am the only one working, but I was afraid I would die if I kept going to work. Can you help me?" We know that people in Iowa will die from COVID-19 because it is already happening. We know that people who have chronic conditions will die at higher rates from COVID-19. It is already happening. And we know that minority groups are disproportionately impacted by COVID-19. These facts are sad but undeniable. So now is the time to come together as a community to protect the most vulnerable among us. This is a decision we need to make, and we need to make it together. If we don't, we are forcing many individuals with chronic conditions, like this mother, to make a gut-wrenching decision to quit her job, or a dangerous decision to continue to show up to it every single day. We all have to do better. The recent outbreaks in meatpacking plants and factories, like the 86 workers in Columbus Junction who tested positive, is a crisis. Workers dying on the job is a crisis. These folks are working hard to keep food on our tables, so we owe it to them to ensure that they can go back to their own table and share a meal with their own families after their shift is over. Now, there are some good actors out there doing the right thing to protect their workers. I appreciate them sincerely, and I hope you will communicate with your peers, who may also be your competitors, to encourage them to adopt these practices. We need this kind of teamwork during this moment. While stronger guidance and stricter regulations must certainly come from the state level, I will be doing my part by working closely with our Linn County Public Health Department to reach out to these companies in our county to ensure best practices are being followed and that our essential workers have been provided a safe working environment. Thank you. Next, you'll be hearing from Heather Metter.
Good afternoon. My name is Heather Metter, and I am the supervisor for the Clinical Services Branch at Linn County Public Health. As of 1 p.m. today, there are currently 301 cases of COVID-19 in Linn County. There have been 21 deaths, and 151 individuals have recovered. Linn County Public Health is in contact with all Linn County long-term care facilities on a daily basis to assess potential outbreaks of illness. There are currently 2 outbreaks at Linn County long-term care facilities. Heritage Specialty Care continues to experience an outbreak of COVID-19. As of today, 105 staff and residents have tested positive. 17 of those residents have died, and 27 residents have recovered. Linn Manor Care Center in Marion is also experiencing an outbreak. As of today, 15 staff and residents have tested positive. 2 residents have died, and 22 have tested negative for COVID-19. Linn County Public Health will continue to work with both of these facilities to monitor this situation and help to provide guidance until the situation resolves. Both facilities are working very hard to control the situation and care for their staff and for the residents. We value our media partners, and we respectfully request that the media hold their questions regarding the long-term care facility outbreaks until our scheduled press conferences. We want our long-term care facilities to really focus their attention right now on patient care activities during this difficult time. In addition to long-term care facilities, we are seeing spread of COVID-19 associated with the workplace. Guidance for businesses is located on the Iowa Department of Public Health and the Centers for Disease Control and Prevention websites. Locally, residents can find information on the Gazette's webpage, the Cedar Rapids Metro Area Economic Alliance, and the Marion Economic Development Corporation webpage, in addition to other local business partners. We would like to take a moment to remind employers and employees of recommendations for preventing the spread of COVID-19 within the workplace. Employers that have an employee or suspect an employee of having COVID-19 should work with their local public health department, as that local public health department will do contact tracing for those who may need self-isolation in their organization. This will be done on a case-by-case basis. Any employee that is ill with COVID-19 or any other illness can safely return to work when that employee has had no fever for at least 72 hours, that is a full 3 days without the use of medicine to reduce fevers, and other symptoms have improved, such as cough or shortness of breath, and at least 7 days have passed since symptoms first appeared. All 3 of those need to be met before the employee returns to work. Employees that are not sick, healthy employees that have had contact with a person with COVID-19 should self-isolate at home for 14 days to monitor for symptoms. This is due to the fact that it may take 14 days for symptoms to appear. The only exception to this is law enforcement, EMS, and healthcare personnel. Employers and employees that are concerned about workplace exposure should be reminded that there is community spread, and you should assume that anyone you come in contact with could be sick with COVID-19, no matter how mild symptoms may appear. There are specific actions that businesses need to take to reduce the spread within the workplace. These actions include actively encouraging sick employees to stay home, emphasize staying home when sick, respiratory etiquette, and hand hygiene to all employees, continue and enhance routine environmental cleaning, stagger work shifts, breaks, and lunch schedules, encourage working remotely, maintain a distance of 6 feet between each person, wear a mask to protect others from potential spread, especially if social distancing is difficult. It is important to remember to help prevent yourself from getting sick by washing your hands often, not touching your face, staying home when you're sick, practicing social distancing, and other prevention activities. Linn County Public Health has been proactively reaching out to employers to provide guidance and reduce the spread of disease within the workplace. We have also been receiving complaints of businesses not complying with the governor's orders, and we are referring all callers with complaints to the Iowa Occupational Safety and Health Administration for compliance enforcement. The number for individuals concerned with workplace conditions is 515-725-5261. Today, the governor and the Iowa Department of Public Health announced the Regional Medical Coordination Center, Region 6, which includes the counties of Allamakee, Benton, Blackhawk, Bremer, Buchanan, Clayton, Delaware, Dubuque, Fayette, Grundy, Howard, Jones, Linn, and Winneshiek have reached a score of 10, according to the metrics used to inform IDPH of mitigation measures. Previously, we had been informed that this would mean a shelter-in-place order may occur. However, today no shelter-in-place order has been given by the governor. She has provided the following guidance. The proclamation limits social, community, recreational, leisure, and sporting gatherings in Region 6 to only people who live together in the same household. It continues to limit weddings, funerals, and other spiritual or religious gatherings to no more than 10 people. The proclamation also requires people to remain 6 feet away from people outside their household whenever possible, and requires employers to take reasonable steps to increase telework and adopt reasonable precautions to protect the health of employees and the public at any in-person operations. The order is effective at 11:59 p.m. on April 16th and continues until 11:59 p.m. on April 30th. As a final reminder, the daily stress caused by this virus, social distancing, and a deep financial crisis is having a big impact on all people in our community. It is normal to experience feelings of isolation, anxiety, and uncertainty in this abnormal situation. Prioritizing your mental health and staying connected is more important than ever. If you need support for you or your family in this very difficult time, you can call the Foundation 2 Crisis Line at 319-362-2174 or the Your Life Iowa line at 855-581-8111. For more information and resources, visit the Gazette's Coronavirus Resource page for residents. Additionally, this can be a very difficult time for those dealing with addiction. Addiction treatment providers are available to help. Contact your local substance abuse provider for more information. Linn County Public Health is sponsoring weekly virtual town halls on topics related to COVID-19. Tomorrow's virtual town hall topic is mental health. More information on how you can participate in the weekly town halls can be found on the Linn County Public Health website at www.linncounty.org/COVID-19. We will all get through this together. We all need to take individual responsibility for our actions. We need to use our Iowan sensibility to protect ourselves and to protect each other. This is a marathon, not a sprint. Stay home, stay safe, and be well. Thank you.
Good afternoon. My name is Wayne German. I'm the Chief of Police for the City of Cedar Rapids. To best comply with the provisions that Governor Reynolds issued today regarding her proclamation, City Manager Pomerantz asked me to share that the city will be closing Gardner Golf Course and the Cedar Rapids Disc Golf Courses at the end of business today. The police department has been receiving questions about additional enforcement-related activities related to the governor's orders that take effect tomorrow. I want to again remind everyone that the Cedar Rapids Police Department has been and continues to remain focused on educating the public about this public health emergency proclamation. Officers continue to educate the public about the proclamation provisions in an effort to keep citizens safe and to prevent further community spread of COVID-19. Since this crisis began, in almost every instance when an officer has encountered a group, the group has been primarily family members, couples walking, running with each other, or parents with their children. Officers have only issued a handful of warnings to some gatherings, but has not had to issue any citations, with the exception being the incident that occurred at Beaver Park, where 4 individuals were charged Investigation had determined that a fight had been planned involving numerous individuals, and the fight resulted in a shooting. And this shooting expended healthcare resources at a time that hospital staff is trying to focus on helping those who are suffering from COVID-19. I also want to remind everyone again that exercise is an important component of mental health, and it is encouraged to exercise with proper social distancing. I also want to emphasize that this is not about more powers being given to law enforcement. This is about people doing the right thing to protect themselves, their loved ones, and others from this illness. Thank you.
This is the end of the prepared remarks from our speakers for today. We do have time for a few questions. For our media partners, please indicate to the moderator if you would like to be entered into the queue. As a reminder to our speakers, please repeat the question before responding. For our media partners, Dr. Arnold from Unity Point is also available for questions. It looks like our first question comes from Travis Breeze at KWWL. Travis, go ahead.
Hi. So my question is for Supervisor Stacey Walker. Stacey, I know you talked a lot about the attention you've been paying to the outbreaks throughout the state at meat packing plants. Given the big companies in the Cedar Rapids area, kind of some of the grain companies like Quaker Oats and General Mills, I did want to specifically ask if you feel the situation is different in any way, when comparing those type of operations to meatpacking operations, and if that's a different kind of communication or a different kind of level of attention being paid.
Thank you for the question. Caitlin, I need to repeat the question, or was the audience able to get it?
Please repeat it.
So I'll try to paraphrase the question here. It was asked if we are viewing large companies like Quaker Oats and other grain processing and manufacturing companies in Linn County, Cedar Rapids specifically, in the way that we view meat packing plants. And I'll just say this, we certainly understand that there are essential workers of all stripes. And grain processing plants are critical to the food supply chain. And for our part, as I mentioned earlier, I think it's incredibly important that there is more leadership on this issue from the state level, but from our part, I will be working with Linn County Public Health as we continue our efforts to understand what practices these large companies have in place to keep their workers safe, if they're adhering to best practices, and if there's anything they need from us to increase those efforts. Because our goal, obviously, is to keep as many people safe as possible. But in addition to these larger sort of plants that are involved in the food supply chain, we are certainly interested in large employers of all types that have essential workers, no matter the industry. So we're going to do as best we can to provide guidance and to provide oversight, if quite frankly, to these large companies.
We also have several questions for Heather Metter from Linn County Public Health. Mary Green, go ahead with your question, please.
Great, thank you. Hi, Heather. Just a quick question. With the governor's order starting tonight for RMCC Region 6, just for clarification, how is this different from the earlier guidance that you all at these press conferences have been stressing for weeks, and that the state has also been stressing as well? What's the difference that will go into effect tonight?
Thank you for that question, Mary. So Mary's question is, what has changed with the governor's new proclamation when compared to what we have actually been saying for the past several weeks? And Mary, I think you've hit on that. The proclamation, we have been saying the same things that are in this proclamation for several weeks now. The big difference is that we're really looking at those social gatherings when you might be getting together with friends, getting together with neighbors, thinking, well, it's okay to be with other people within our neighborhood, our community. And it's really putting a limit on that, saying you really only should be with your household contacts unless you are at work. So, or going to an essential service like the grocery store, going to the pharmacy to get your needs met. So it's everything we've been saying. It's just putting a little bit more enforcement on that piece of don't be with your neighbors, don't be with other people in the community, stay at home, stay with your family. If you need to go to work, then go to work. Practice those things that we've been talking about: social distancing, wearing a mask. The mask, again, is not to protect you, it's to protect others from you. But doing those things that we've been talking about, but it's just putting a little bit more enforcement behind that. So does that answer your question, Mary?
Yes, it does.
Okay,
And I
great.
have one more for you, but if this is something that would be better answered by Chief German, then that would be fine.
Okay.
But seeing as it's not just Linn County in this region, 13 other counties included as well, is there any sort of coordination with those other counties as far as either enforcement or just organization to kind of get everyone on the same page at all?
So Mary's question is if there's coordination with the other counties that are part of Region 6 with this outbreak. So Mary, you're talking about law enforcement in particular then with coordination activities?
Law enforcement, or even if it's with other counties' public health departments, or really any just sort of coordination with, specifically with Region 6.
Okay, so maybe we could divide this up into two parts. So Mary, I'm going to take that question into two parts. So I'll let the chief answer the law enforcement part. As far as other activities that are occurring within our region, we have several residents within Cedar Rapids that work outside our region. So we know that we have individuals that work outside our county at other factories, industry, it could be smaller hospitals, even outside our Region 6, even to Region 5, which would be Iowa City, Johnson County, we have residents that go down to Johnson County for jobs. There is a lot of coordination between health departments, a lot of conversations that occur that we will talk to each other if we have someone that's been diagnosed but goes into another county so that they're aware of potential contacts. We will also reach out to those businesses. We have, as it's been stated in the news, we have the issue with the Tyson plant in Loiza County. We have many people that work at the Tyson plant in Blackhawk. We have individuals that work at the Iowa beef packing plant in Tama. If we were to have someone, one of our residents that would be sick at one of those plants, yes, we would reach out and we would do coordination with that business because we want to protect our residents the best we can. And so that might mean that we're reaching out to some of those businesses because that's protecting our population as well as protecting their population too. So there is a lot of coordination with those activities in regards to public health and contact tracing. And I'll let the chief answer the law enforcement questions.
Yeah, thank you. I cannot speak for other law enforcement leaders outside of the city of Cedar Rapids. I do know that some are drafting their plans probably as we speak. Since this information just came to our attention just a few hours ago, we have been developing what our response is going to be. And really, our response is going to continue to, again, warn, notify, and ask for voluntary compliance. However, we are prepared to issue citations or charge individuals who refuse to comply. So I hope that answers your question, Mary.
Yes, it does. Thank you.
It looks like the next couple of questions are for Heather. And the next question can come from Travis Breeze.
Hi, thank you. Heather, I believe I am quoting Governor Reynolds correctly, that she, in her press conference this morning, talked about the state looking at making what she called strike forces that would go to long-term care facilities in parts of the state. I think she said these teams would consist of, maybe healthcare professionals or, nurses that would ensure that best practices are being done at long-term care facilities. I was wondering if you would say this is, the kind of outreach or coordination that you would look forward to.
Yep.
And also if you have had any conversations with the governor's office or with state officials about having those kinds of people come in this way.
Thank you, Travis. Travis is asking about when the governor had her press conference today, she spoke about the term she used were strike teams to come out to help with outbreaks at long-term care facilities. I think she had also mentioned that it would be at different industries or employers that were having outbreaks. So we did reach out to the Iowa Department of Public Health for more clarification on that topic. It sounds like it's really being focused more for those smaller counties where they don't have a public health system that's quite as robust as what you're going to find in some of your larger communities. So when she was talking about that, yes, it would be a great idea if you have a smaller county where you may only have 1 or 2 people in your health department serving that entire county, you're going to need some extra help with that. At this point in time, it would be something that we would only ask for if we felt like we did not have enough support within our own county to meet the needs there. So I think it's a great idea for those counties that would be smaller, that would need that additional support. For our larger counties, though, it may be something that's not needed because we would have a system in place to help take care of those individuals. Does that help to answer your question, Travis?
Yes, that does. And thank you for clarifying strike teams. I appreciate that.
Yeah, no problem. Thank you.
And our final question today comes from Michaela Ram at the Cedar Rapids Gazette. And this question is also for Heather.
Hey, Heather. So I was hoping to ask you something about comments you made during your remarks about guidance you offered to those long-term care facilities,
Yes.
Experiencing an outbreak and working with them until their situation's resolved.
Right.
Could you offer more details? What sort of steps are you having them take that they aren't already taking to mitigate the risk?
Hi, Michaela. Thank you for the question. So Michaela's asking for more information on the steps that we're taking with the long-term care facilities that are having outbreaks. So what happens right now is every day there is a survey that's filled out by the long-term care facilities within the county. And on that survey, it tells us how many people are experiencing illness within the facility, how many staff members may be ill in that facility. And then we reach out to any facilities that we see 2 or more individuals are experiencing illness so that we can find out what's going on within those facilities. And then we will help determine if maybe testing is needed, depending on what we've heard from those illnesses. We'll talk about cleaning procedures. We'll talk to them about staffing for those facilities. It may be on cohorting, so separating the healthy residents from the ill residents. And then when we notice a situation like what we have at Linn Manor or with Heritage, we work with them on a daily basis. Every day we have a scheduled phone call with them where we go over all the patients that are experiencing illness to find out what is going on with their illness progression. We find out how they're doing, if they're doing better, if they're getting any worse. We go over cleaning again. We talk to them about their personal protective equipment to make sure that they have enough of that PPE available for their staff, because we do want to protect the staff. We want to protect the residents. So we talk to them every day to help see what's going on, how can we be of support, what do they need, how can we help fill those needs, and just to make sure that they feel like they have the support that they need to continue through this outbreak. It's hard for our long-term care facilities. They're having staffing issues when their staff are ill and not able to take care of residents. It's a lot to go through. This is a change for them. It's a lot of stress that they're going through. They care very much for the residents that they take care of. So we're there to help provide support for them, for the residents. So that's what we're doing on a daily basis. Does that help to answer your question, Michaela?
Yeah, it does. So it's not necessarily a situation where you guys are physically showing up at the facility to assess what's going on and make sure they're taking the steps that they need done?
No, it's all over the phone. Again, we do not really want anyone besides the people that live there or work there to go into the facility. Every time a new person enters that facility, there would be a situation where they could potentially bring COVID-19 within that facility. So we want to limit the number of people that go into that facility because we don't want anything brought in unknowingly into that facility. So we really need to limit. That's why the facilities are limiting or not accepting any visitors whatsoever. We've also talked to our EMS professionals about even limiting the amount of time and number of people that might be going into the facility if transport needed to happen. We need to limit that exposure to help protect the residents and to help protect the staff, and so everything we're doing is over the phone.
Okay, absolutely. And then another question in addition to that. So do you know if there was any special guidance or precautions issued to those long-term care facilities that may have done poorly on infection control inspections in the past, either by the state or local public health? Does anything like that happen prior to this pandemic?
So that is all done by other agencies. It's not done by the local public health. I believe that's done by the Department of Inspections and Appeals, so you would have to follow up with them to get more clarification on that question.
Okay, thank you.
Yep, thanks, Michaela.
That does conclude our press conference for today. Our next press conference is scheduled for Monday, April 20th at 3:30. I do want to say that we please want to welcome others to join us for our virtual town hall that will be held tomorrow, Friday, April 17th at noon, focusing on mental health during the COVID-19 pandemic. You can visit www.linncounty.org/COVID-19 for more information. And just briefly, I'll summarize the Linn County metrics to date. Linn County currently has 301 cases, 21 deaths, and 151 that have recovered. Please practice social distancing, stay home when you're sick, and wash your hands often. Remember, stay safe and stay home. Thank you.